Hi, I'm Florence Jones, Chief Nursing Officer, Methodist North. I hope you enjoy our first electronic newsletter, Nursing Nuggets. Nursing Nuggets will be published monthly by Nursing Administration. The monthly link will include key updates, news, recognitions of associates, anything that impacts nursing services. Today, we want to share updates related to Joint Commission. Catherine Wiggs and Lynn Wilson will provide those updates. Lynn?
Hi, we will be having our Joint Commission visit next week. Just a couple of things to remind when you're sending patients in the procedural areas or you have vendors in your area for patients that have had an implant of some kind such as a pacemaker. But first let's talk about the H&P. The H&P is the most important document that a patient can have when they can come to a procedural area. As you will see on the screen, you will see the elements listed that must be included in that H&P. Please check when you're looking for that document, when you say H&P in the columns, to open that and make sure it's not an anticipated document. If it is, please call and ask that attending physician to get it in the chart before they come. This delays surgery or procedure because we must wait for that before the patient can go back to have it performed. The other thing that I would like to talk about is vendors when they come to your areas, sometimes to interrogate a pacemaker. Vendors have to have access through our purchasing department and have met certain criteria to be in the patient's rooms or in our hospital at all. They have a machine in the radiology waiting room called RepTrax that they put their information in and it will print out a badge. If they are up on your unit, please look for the badge and it will have their picture, their company, and more importantly, the date and time that they registered in the hospital. It must be visible, it must be for that date, and if it is not viewable and they do not have it, you must ask them to leave that area. I know Joint Commission is going to go smoothly. You're all ready, and I wish you the best. And now we'll have Catherine talking about her updates.
Hi, this is Catherine Wiggs, and just going to hit a few of the highlighted areas that I think we need just a reminder about as we get ready for our Joint Commission survey. First one is restraints. I'm not going to go over everything on the screen. Just some of the main things is being sure that the initiation form is completed within 15 minutes of the restraint order when they're initiated, and being sure that the restraint box is checked on the plan of care. And the knowledge deficit plan of care, that restraint box is already pre-checked, so you don't have to remember to have to do that. And then the last thing is remembering to notify the attending physician when the restraints are initiated before, and getting that documented before the end of your shift. And another area is pain medicine administration. Just be sure that when you give your pain medicine that you're giving it for the pain scale that medicine is ordered for. And if the patient's pain is a 7 but the medication's for a pain scale of 8 to 10, that we need to either get a new order from the physician or clarification from the doctor. And if when the doctor gets that, to please have him enter a new order and not modify the existing pain medicine order. And then when we look at the plan of care, just to be sure that we get these individualized, because what we're seeing a lot on the plan of cares is the discharge is the desired goal date for that plan of care, and that really does not look individualized to a surveyor, because when all of the plan of cares have the desired date, discharge date for their goal, they don't look at that as being individualized. And then also titrations, Joint Commission surveyors are really looking at this with a fine-tooth comb. So be sure that you give and that you titrate the medications accordingly to how they're ordered. So if it's ordered to be titrated 2 mics every 15 minutes, that is how we're titrating it. We're not accidentally titrating it 4 mics just so we can reach our desired outcome quicker, because they're looking at this one with a lot of attention. And then the last thing is just some miscellaneous items. You can see the list here on your screen. Main thing is if you've got open juice and milk containers, they have to be dated, and that they can't be in the refrigerator beyond three days beyond the label date. And keeping the linen carts covered. and that there's no, because the medications also have to be secured. So when you've got medications or saline flushes in the basket on your wows, those are not considered secured. So be sure that those type of medications are not in your wows. And then being on the contact times is a minute for the peroxide wipes and 3 minutes for the bleach wipes. And then the last thing I want to hit is the patient identifiers are the name and PIN number. Several associates are still telling us it's the name and birth date. That's only for the outpatient area. So if they're an inpatient, there are 2 patient identifiers are the name and PIN. I'm now going to give it to Dr. Jones, who will be closing us out.
Our mission at Methodist North for Nursing Administration is working collaboratively with our team to provide compassionate and evidence-based care that centers around our patients, families, and the communities we serve. We need everyone on our team to be engaged to be successful with our Joint Commission survey. Passing Joint Commission is important for our patients in our community. On behalf of Lynn, Catherine, and myself, I want to thank each of you for your dedication, hard work, and preparation for the Joint Commission survey. I know we will be successful.